Okay. Good morning. Good morning. I'm Dave Kindig from the University of Wisconsin School of Medicine and Public Health and co-chair of this roundtable, our roundtable on population health improvement, and we welcome all of the roundtable members back and those of you joining us on the web. As you know, this meeting is recorded and webcast. This roundtable provides a trusted venue for leaders from public and private sectors to meet and discuss the leverage points and opportunities arising from changes in the social and political environment for achieving better population health. The Roundtable's vision is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. The vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, behavioral, and healthcare factors and will require robust national and community-based policies and dependable resources to achieve it. As one of its major activities, this roundtable sponsors workshop for members, stakeholders, and the public to discuss issues of importance to the public's health. As you know, today's workshop will feature presentations and panel discussions on the topic of communication, an area of deep interest to the Roundtable since its founding. The Roundtable has identified 6 drivers it believes will shape population health improvement and that the Roundtable hopes to influence through ongoing dialogue that catalyzes action among our members and partners. 6 drivers are metrics, resources, relationships, research, policy, and today's topic, communication. Each of these drivers is essential for our goal of total population health improvement and disparity reduction. And we have been bringing to light state-of-the-art science and practical experience in the series of workshops over the last 2 years, some of which were innovative resource streams, health and all policies, components of social movements, education and health, and most recently the business role in health and population health improvement. None of these topics or drivers is singularly important, but effectively communicating these ideas and opportunities is critical and vital to achieve our vision and mission. This is particularly challenging in our field because these fundamentals are complex and often counterintuitive to general public understanding, like health is more than medical care, like improving overall population health does not often reduce gaps across subgroups, like healthy behavioral choices are not easy, solely free will choices for many poorly educated and economically challenged persons. These fundamentals are both true and at the same time extremely difficult to communicate, particularly in a country as geographically, culturally, and politically diverse as ours is. So I'm really pleased and very grateful to Sanne Magnan, who chaired the planning, one of our roundtable members who chaired the planning committee for this workshop on communication to advance the public's health. Dr. Magnan is CEO of the Institute for Clinical Systems Improvement in Minnesota and former Commissioner of Health for that state. Dr. Magnan.
Good morning, and thank you, David, for those comments that you always do so eloquently. I am pleased also to welcome you today to the IOM's workshop, Communication to Improve Population Health. Thank you for coming and/or joining us by webinar. We'll spend the day exploring communications and the role that communication can play in helping us achieve our goal, our mission of improving population health. Please refer to the agenda for more detailed objectives for the day. As we prepared for our workshop, we started with obtaining additional feedback and direction from some top communicators. We were quickly reminded, though, that we first needed to answer the question, communication to what end? A little more specificity than we had originally had in some of our materials. So what were we trying to accomplish? If communications is an art, science, approaches to help us achieve our ends, what were we trying to accomplish? And could we clearly articulate that? There's a lot that we can cover in population health, and our scope of our vision and mission is immense. So in order to bring some clarity and focus, we asked our co-chairs to put a stake in the ground, and they set 3 goals. 1, increase life expectancy and reduce premature death. 2nd, decrease disparities. A long, healthy, productive life should be available for all. Decrease per capita spending as our 3rd goal. Make care more affordable. Decrease per capita healthcare spending. And then invest in other areas that will increase health. So as one communication person said, when you're thinking about your goals, people want to think that communication is all about the message and it's all about the words. And if we could just get the words right, that things would change. But having your goals in front of you, putting your goal first, is one of the key communication principles. So what other principles did they tell us? Know our audiences and develop messages accordingly. To whom are we communicating? Makes a big difference in how our messages should be crafted and whether they will or won't be heard and acted upon. Add repetition as an essential ingredient. Repetition, repetition, repetition. Answer, what's in it for me? The with them. And make messages, quote, crunchy, end quote. Make them, as one communication expert said, make them as concrete as possible so people know what you want them to do next. So thinking about our goals, those 3 goals that I mentioned, we know these facts. We know that rising healthcare costs are not giving us the outcomes or the appropriate value for all the money that is being spent in the U.S. And we do not have the best outcomes in the world for all that money that's being spent. We're not investing wisely in the other factors that are upstream that could keep a population healthy. For example, we've seen investments in education deteriorate relatively over the years. We can do better for all people in the U.S., and there is enough money in the system to not only care for all, but to eliminate the disparities that are in our populations. One obvious place is to take the waste out of healthcare that the IOM identified in the report, The Healthcare Imperative, Lowering Cost and Improving Outcomes. Then reinvest the savings in other areas that can make a difference in the social determinants of health. We all know these facts and we all know these strategies, but how do we make them resonate? When I was Commissioner of Health, I often heard people describing health in one of 2 ways. And I want you to think about your gut reactions to each one. So first view, good health is primarily personal responsibility. Second view, good health is primarily the responsibility of the community. During my tenure as Commissioner of Health, I often heard these voices from different sides of the policymaker aisles. But good health and good approaches isn't a partisan issue. Good health is a bipartisan issue. I try to understand each view's perspectives and to see what kernels of truth might be in both of them. More than likely, as I've been told by some experts, I'm not going to actually change their underlying values, but I might be able to change attitudes or behaviors. So often, I told this story to try to bridge these two different worldviews that I heard from policymakers. I live in inner city Minneapolis, and I try to go out most nights of the week for a walk. It's my personal responsibility to put on my tennis shoes and go out the door. But if I didn't have a neighbor who would go walking with me, if we didn't have sidewalks to walk on, if we didn't have lighted streets in a city that if we called them when one light pole went out, that they would replace the light and make it safer for us, and if we didn't have police patrolling the area, we probably would not have gone walking. I would not have felt safe, I would not have felt encouraged to do so, and it wouldn't have been fun. So I would often say to people, it takes both. It takes my community's efforts, and it takes my personal efforts to make my walking possible. It's not an either or, it's a both and. Personal responsibility and community responsibility are intimately and deeply twined. Place matters, people matter, and making it easy for people to take next steps matters. I learned that I needed to communicate about each of these factors so the message of health could be heard in the setting of the policymakers' values. And it depended on whom I was talking with and which one I might have as leading statements. I was employing a basic communication principle, unknown to me explicitly at the time. Identify and know your audience, tailor your message to the audience, and tell a story to illustrate the point. I'm pleased to say that during the 2008 legislative session in Minnesota, we passed bipartisan healthcare reform legislation, which included a historic investment of $47 million in a statewide health improvement program called SHIP to focus on policy, systems, and environmental changes related to tobacco, physical inactivity, and poor nutrition, the leading preventable causes of illness and death in the U.S. We learned a great deal about communication that worked and communication that didn't work with policymakers and the public around this effort. Today, we want to focus on more stories and learnings and science from the field on what works in communications. Considering our vision, our mission, and our goals, and the advice of communicators, the Planning Committee, with the expert IOM staff, and especially Alina Bachu, planned and developed the workshop for you today. First, we will start by grounding ourselves in the science of health communications. Subsequently, we will hear several perspectives on how the news media informs how not only the public, but also officials understand health and what makes people healthy. Our communication expert consultants told us if you want to influence policymakers, influence the media, because that's often who policymakers listen to. We'll also learn later in the day about the power of social media and how we can use it to our advantage, an area that if you're anything like me, we don't understand nearly as well as we should. After lunch, we'll delve into how to identify our audiences and craft messages that will resonate. We'll end with a look at the power of TV and film and how these mediums can help us reach our goals and wrap up with reactions and discussions about what future actions should be. Of course, there's much more that we could put into a workshop on communication principles, but I'm excited about this program that we have today. I see it as a journey towards better communication to achieve the health for all with the right balance of investments in our nation for a vibrant economy that supports well-being. Again, thank you for being here, and we'll get started with our first speaker. So I am pleased to introduce Dr. Bob Hornick for our keynote, and our keynote is entitled The Science of Health Communication. Dr. Hornick is the Wilbur Scram Professor of Communication and Health Policy at the Annenberg School of Communication, University of Pennsylvania. Since 2003, he has directed Penn's National Cancer Institute-funded Center of Excellence in Cancer Communication Research. And that center recently ended at the end of August, and now he is co-director of Penn's Tobacco Center on Regulatory Science. He's also led the evaluation of more than 20 evaluations of public health communication campaigns, including those focused on child survival and HIV prevention throughout the world, as well as the evaluation of the U.S. National Youth Anti-Drug Media Campaign. He's the author of Development Communication, editor of Public Health Communication, Evidence for Behavior Change, and co-edited Prediction and Change of Health Behavior, as well as more than 100 refereed articles and papers. He has served on 4 U.S. Institute of Medicine committees. So please join me in welcoming Dr. Hornick.